Welcome to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness throughout your journey in life. Your host is Dr. Mohammed Emran, a respected and experienced physician who has treated thousands of patients across the United States over the past 10 years. Listen to Dr. Emran each week as he explains medical topics and life-changing treatments. Thank you for joining me today on Simple Health Radio. I am your host, Dr. Emran. On today's show, we'll be discussing small bowel obstructions. Our legal disclaimer indicates that none of the information provided on this show can be used to diagnose, treat, or manage any health conditions. This show is not a substitute for professional medical advice. Always verify the information that you hear and see your doctor in person or go to the emergency department with any concerns you may have. The gastrointestinal system, also called the GI system, is divided into many parts. Food is chewed and enters the stomach during the first phase of digestion. The stomach then connects to the small intestine, which is about 20 feet long. The digested food then enters the large intestine, which is about 5 feet long, before leaving the body as stool. So in total, we have 25 feet of GI tract. Now, a small bowel obstruction, also called SBO, refers to a blockage that occurs in the small intestine and is a life-threatening condition. Small bowel obstructions are painful, cause nausea, vomiting, swelling of the abdomen, and symptoms that may seem like diarrhea or constipation. However, the obstruction can be partial or complete, which means even gas cannot pass through the intestines. There are many causes for small bowel obstructions, including Crohn's disease, previous radiation treatment, food blockages, surgery, hernias, abnormal amounts of air, any twisting of the intestine, and solid tumors. In the emergency department, there are several tests that can quickly diagnose a small bowel obstruction, including X-rays or CT scans. The CT scan is usually performed with contrast to help light up different areas of the intestine and pinpoint the exact area of the blockage. There are different ways to treat a small bowel obstruction depending on the cause, the severity, and the location. However, all patients require hospitalization for management, which includes pain medications, IV fluids, nasogastric tube, and possible surgery. A nasogastric tube, also called an NG tube, is a flexible, narrow plastic tube which is passed through the nose, down the esophagus, and into the stomach. The NG tube actually pumps backwards to remove air and fluid from the stomach, which helps to decompress everything downstream, including the small intestine. For many patients, this is the only treatment that's required and can actually prevent surgery. Surgery is required, however, if there is a hernia. A hernia is a tear or weakening in the muscles of the abdominal wall, which allows the intestine to slide back and forth. Sometimes the intestine will slide through the opening of the hernia, but it will become unable to slide back where it came from. This will cause strangulation of the intestine, basically a twisting that occurs outside of the abdominal region. In these cases, the only treatment that will work is emergency surgery to actually push the intestine back where it came from and then stitch the hernia opening closed to perform a proper surgery, and this will prevent the obstruction from developing again in the future. Other types of surgery focus on the damage in the small intestine which can occur from the obstruction. If the obstruction is severe and involves a lack of blood flow, the tissues actually die. Ischemia is the medical term when there is not enough blood flow to a certain part of the body. Necrosis occurs when the tissues have already died due to a lack of blood flow. This can lead to very serious complications, including death. In this case, the entire affected portion of the intestine must be cut and removed. The healthy ends are then stitched back together. This is a very serious procedure and requires weeks or months of healing. If you or your family members have any of these symptoms, please contact your doctor or go to the emergency room for a proper evaluation. Small bowel obstructions must be diagnosed quickly and treatment must begin immediately. There's more information on my website, simplehealthradio.com, along with diagrams and more detailed descriptions about small bowel obstructions and other serious conditions. I welcome your feedback and look forward to seeing you on my next show.